pass these around. Everybody take one of those 2-page. My talk will be on something different, more extensive. This is my article. I wrote about this on my website. And I actually did a interview on Channel 19 back in 2001 on this LED Photo Light Therapy. And also, I'm going to be posting it on a YouTube video. And I have Pamela Gordon, who went to Sri Lanka, was an acupuncturist that was using a cold laser, and then she went to the LEDs. Let me explain that cold laser is, they take the powerful lasers that they were using for surgery, even for eye surgery, and they lowered the power way down. They found out that you could stimulate the acupuncture points, sedate if it pulses. Sedate if it's solid, pulsing it stimulates it for different effects, but also for healing the eyes. Well, I can go into a lot of things here, but let me get into the history and the background of this. The Germans found out, though, let me explain this. Lasers use a light wave that is in step with each other, so it's coherent light. So that they reinforce each other. If you're looking at it, it looks like waves, if you can see it on a oscilloscope, although it's very, very high frequencies, it'd be hard to do that. But everything's in step with each other, reinforcing each other, like, you know, one behind the other, just lockstep in the photons, the light particles. Whereas the LEDs are incoherent light. The light waves are not in step with each other. They're slightly out of phase with each other, so it's not as powerful. But because the LEDs put out a monochromatic light, the same as a laser, which means single frequency light, the Germans found out that they're 80% as effective. Okay, I had a woman, and her husband was a facial surgeon, and she would apply the red LED, 660 nanometer. At the time I was using 627, but 660 is more compatible with the body, on the area of the face where he was working. Okay, then she would treat them afterwards, light painting the area, and they would have virtually, if any, no scar tissue at all, and the healing was like 10 times faster. And this works through the meridians. Your meridians, which has been proven scientifically, it's nothing wubba wubba type of thing, are like fiber optic cables. And the red light, or in case of other colors, it follows that to wherever it needs to go. And as I was telling Lisa, there's only one thing that can block it, and that's where you have to get into a pulse light. I want to come out with one, 292 pulses per second, or hertz as they call it. That unblocks the scar tissue, because scar tissue will block healing. I don't care what kind of healing work you're doing, if the person's not getting results, I've usually found there's two things: either reverse polarity, the C1 and C2's out of alignment, okay, and they're jammed up, and you go in reverse polarity like cats and rats. That's why they love valerian and catnip, because it stimulates their nervous system, whereas with humans it normally calms us down. But if you take those and you're getting, getting real stimulated, or you take caffeine, it does nothing for you, you just fall asleep. You're in reverse polarity. But scar tissue is another thing that usually is blocking healing too, and that's something that most people don't address. Hardly any natural healers get into that, but there is a frequency that you can pulse the red LED at, 290, which I'm going to have that. I had it on my bigger unit, but I haven't had that out available for a while. I'm going to get back to it, but that's kind of getting off the track here. But the most important thing is the monochromatic, the single frequency. It's just one single frequency. It's not white light that's been filtered like Dinshaw's work, the color therapy work. It's a type of color therapy, but it goes much deeper. It's much more powerful. I have a farrier which he shoots horses down in Texas. It sees miraculous things with horses with this, and they've been using this on horses before that. But he actually saw something that usually lasers will do. And horses, by the way, respond much quicker. I'm an herbalist. They respond much quicker to herbs. They respond much quicker to the phototherapy. He calls red lighting it when he treats the horses. But he's actually seen wounds heal up right before his eyes. Not instantaneously like that, but it's a slow. He says within 15 minutes the wound is completely shut. We're talking about a wide open gap. So, but that won't necessarily work on humans, because humans we're so toxic. We're so bombarded with electromagnetic fields. We're just not as healthy as animals are. They live close to the earth usually, and they're more into it. They know to eat grass when they get sick. So LED phototherapy versus cold/soft laser therapy. All the latest medical therapeutic methods seem to have a common target: to increase and stimulate blood circulation into the area being treated by various stimulants and steroids. Usually it's treating symptoms rather than the root cause. A light-emitting diode phototherapy unit, which is my photon torch here, 3 watt, however, improves and stimulates blood circulation using a completely natural method, a light beam. Light being absorbed by the skin, underlying tissue. It goes about, laser will go deeper, like a 3/4 of an inch. This will go about a 1/2 inch, okay? Some people on the internet are claiming an inch. Does not do that. But the thing is, if you go through an acupuncture pipe, like this is the main acupuncture point for pain, large intestine 4, as Lisa knows, she's studied acupuncture. You put your forefinger and your thumb together, and that little mound of flesh that pops up, it pops up higher on a man than it does usually on a woman. But you shine a light on there for about 5 minutes, and usually it'll get rid of pain somewhere in the body. Now, we're still treating symptomatically, but when you're in pain, you don't care. You want that pain gone away. And I used it for when I had my lower back injury for years. Now I built up a tolerance, and I have to go to a blue light these days. So the blue is a cooling action. The Chinese, by the way, there's another thing. The Chinese believe in stimulating. With like acupuncture, they stimulate the pain. They stimulate on pain. And what happens is the pain gets worse. It's actually like, I had an electrostimulator when I went to a Mexican cancer clinic. I was working with a young man who had lung cancer, and we'll get into that another time. It's ozone inhalation therapy. And there was a young woman in another room that had fell, she was mountain climbing and fell off the mountain and almost died, but she had some severe injuries, and she had pain in her breast, just enormous pain. And so I loaned her, I brought it with me because I was having sciatic pain, and I was using it, and I didn't need it. I says, here, borrow it if it'll help you. So when we first applied it to her, right there, her eyes got real big when I put it on the stimulating mode. I mean, it looked like she was about ready to strangle me, because she was already enduring some really high amount of pain, and all of a sudden, you could see it was like a curtain came down. Her face completely changed, and the look of relief was unbelievable. She had been putting up with this pain for months. Morphine wasn't even touching it. That's pretty bad, okay? And she hugged me and thanked me, and I said, hey, listen, keep the thing. You know, if it'll help you, keep it. Use it. So I didn't need any more. I just used it for a small amount of time. I like the light better because you do feel that electrical current going through that point, and you tend to build up tolerance to it too, whereas with the light you don't. It took me many years to build up a tolerance to the red light, and then I converted over to the blue light, which is more of a cooling action. But like I say, the Chinese believe in stimulating. That's what this does. It stimulates, and pain can sometimes get worse before it gets better.
Do you use the green light too?
Yes, and it's a balancing, more grounding. In fact, you can use the green light afterwards. Not too many people do it, but I recommend it. Some people have they're not as powerful as this, because when you try to mount 3 or 4 LEDs in these things, you lose the power. But they have it so you got it red, green, and blue, and you can either do them all together or separately. But yeah, the green is a good thing to have. It's a balancing frequency.
Could you go over the types of pain and how quickly they may be healed?
Well, wow, there's many different types of pain. Usually, no matter, the large intestine 4, which is a major acupuncture pain point, right there, usually, I was even using a lot less powerful one than this. Within 5 minutes, my pain would be gone. And when I first started doing it for my lower back injury, I could go for a couple months without the pain ever coming back again. Then it got to be where I built up a tolerance, and I would go maybe a month and a week, a few days, a few hours. It took months before that ever happened, got down a few hours. Then I got to where it wasn't really helping much at all. Then I went to blue, because I read and the research, and I studied so much in the red, I didn't know much about blue. And it started working. It didn't work as well, but it works in a different way. That's a whole different scientific approach there on that with the blue. Let me continue on this. Light emitting diode unit, however, improves stimulation blood circulation using a completely natural method of light beam. Light being absorbed by the skin. I already said that. I'm sorry. The result is all toxins and metabolic byproducts are taken away from the suffering tissue, while at the same time, food/energy and vitamins are supplied through the increased blood current. That also includes oxygen, because that is the breath of life. You got to have. I should put that in there. LED phototherapy is a conscious move towards a natural method of healing. The principle and application of this is through biostimulation of the cells. It actually goes down to the DNA of the cell. I mean, it gets real complicated. It's photon energy. Photons, by the way, have there's no mass, but they have an electrical charge to them. So it's almost like it's almost on an esoteric level in a sense. The principal application of this is to biostimulate cells by pure monochromatic, which means single frequency light. And the healing process, the light is absorbed by the cell, accelerating tissue repair, thus speeding up recovery time. The method of biostimulation is particularly successful in the fields of dentistry, dermatology, neurology, physiotherapy, and you'll see this used around the world, not so much in this country, and is a must in the world of beauty and fitness. Estheticians use it a lot. They can get rid of acne with the blue, which I've got a royal blue here, which is close to ultraviolet, it's less dangerous. But you can shine that on acne, the royal blue, and it'll destroy the bacteria that's underlying within the acne. Okay, it's really, really neat how that works, without having to do any kind of surgery or medicines or ointments or anything. In the healing process, the light is absorbed by the cell, accelerating tissue repair, thus speeding up recovery time. The method, I'm sorry, I already read that. From a nutritional point of view, a lack of sunlight can cause deficiencies, and that's been proven many times. Deprive people of light. It is actually nutrition. Light is, it's kind of hard to believe, but it is nutrition. Light is nutrition, as well as oxygen, which we would think of. And what it boils down to is electrons. I haven't read the book yet, but Roxanne has over there. It's called Healing is Voltage, and actually it's better to say healing is electrons, because all herbs, all oxygen, the photon, all this stuff works down at the atomic level, electrons. What you're doing is you're adding or subtracting electrons away. If you have an overabundance of electrons, that can be good. You want it balanced, but deficiency is the worst part. So that's for another time to talk about. From a nutritional point of view, yes.
Something that's kind of interesting I want to bring up here. I work at a prison and we're getting all these inmates in, and these young people are covering themselves with tattoos. And it's my theory, and tell me if I'm wrong or right, if you cover yourself with tattoos, the skin has 6 layers. Is there any way that sunlight can even get down into it? Great vitamin D, number 1. Number 2,
well, I was just about to say it.
Will this kind of light even penetrate the tattoos to help in healing?
Yes.
It will?
Yes. It'll get down deep enough.
But what about sunlight hitting tattoos? Because it seems to me like if you wear clothes.
Well, no, because that's not as high of energy. It's bright, but it's not high enough energy. Yeah, it would probably. I've thought about that too. Tattoos would probably stop it because it doesn't generate the not melatonin, but melanin. Okay. All right. Without sunlight, vitamin D cannot be metabolized in the human body, which can result in rickets. Most enzymes need light for proper functioning. When babies are born, jaundice, they use a blue light on them. They've been doing that for a long time. The doctors will admit into phototherapy in that case, but yet they won't use it for any other. It's kind of amazing how that most enzymes need light for proper functioning, hormones and vitamins as well. Studies have shown that different lights affect different enzymatic reactions for healing purposes. So,
Tom, it's a little bit off the subject, but
yes.
People in Europe do a lot of sunbathing. Americans don't do that much sunbathing, especially in the Midwest.
Well, real quick, I'll talk about the reason why you get skin cancer. People that the sunbathe and everything, they get skin cancer. It's not from the ultraviolet rays of the sun, folks. No matter what band we're talking about, UVA, UVB, UVC. It's from the rancid suntan lotions and oils, plus the synthetic PABA, which is a B vitamin, paraminobenzoic acid, is used as a sunblocker in there. The reaction of the ultraviolet rays on the rancid oils and the synthetic PABA can create skin cancer. Look at sheep herders down through the centuries that are out in the sun all day long. There was no occurrence of skin cancer until the 20th century. Okay? It was so rare, you might as well say no skin cancer.
They said junk food conditions the skin to be burnt too.
Yes, yes. Now there is one herb that you have to be careful with, and it's rare though. St. John's wort. That makes the skin very sensitive to light.
How much sun a day should people really get?
Well, it's probably a couple hours at least.
I've seen.
But everybody's different. I mean, if you're darker skin,
20 minutes.
you won't need as much. Okay. So, but yeah,
I've seen literature that says 10 minutes on each side.
I think everybody should get in tune with their bodies and find out what they should be taking in. Light is nutrition too. Find out what works for you, what makes you feel healthy. Tune into your body. You can instinctively, intuitively, especially women are more into the intuition than men are, know what you need. I mean, they can do scientific studies all they want, but you got to know your own body and your own mind and tune into that. That's been taken away from us. The doctors have forced us into a left brain mode a lot.
Which three ingredients cause the skin cancer?
The synthetic PABA, paraminobenzoic acid, which is a sun blocker.
Okay.
You can take natural PABA internally, and you'll get dark like you. Me, white skin, I can get real dark, olive skin. Because how many of you know who Fritz Tenenbaum is? The guy that used to do the Night Owl on Channel 10. Columbus. Okay.
Live right down the street.
He's real short,
Yeah.
and you would think by looking at him, because he's got dark hair, that he would normally, not burn. But he told me when I met him in a health food store years ago, he says, I really burned badly, but I found out that PABA, and I didn't know this yet, I found that out. He says, I've been taking PABA, natural PABA tablets internally, and look at me, I don't burn anymore. I'm tanning without burning, and you won't get skin cancer that way. So don't use it in a topical ointment, lotion, oils. Plus, anytime you have oils that are not processed properly or they put hydrogen in them, they get rancid, okay? The rancidity creates free radicals, and that's a whole different thing we could get into a long time. Life extension has talked about that.
Well, what if you want to be white? I mean, I would wear sunblock trying to be white, and it wouldn't work, and I get tan. I know. White people want to be brown. I want to get white. I think white skin's pretty.
Okay, you can buy a bleaching cream that has hydrogen peroxide in it. It'll make you whiter.
No, it doesn't, because I
It doesn't work for you?
No, I put it on my feet, because I'm trying to get rid of
Okay, that's a realm I'd have to research. I can't say on that. I know that some people use that, it works, but they get rid of those liver spots in their, okay. Do a Google search, maybe you'll find out.
So you're telling
And there
us,
may be a,
That's why I'm asking you.
so you're telling us that we should you can take the PABA tablets and then we won't get a sunburn?
no, you won't. You will not get sunburned. I'm telling you, Fritz Tenenbaum, he was looking like an Italian with a tan, natural tan, and it was all because he took the PABA and he did not burn. He was like me. He could get 2nd and 3rd degree burns from the sun. And I've had sunstroke when I've been out because I'm fair skinned and everything. I have to be careful, yeah.
But you have to point out, he got his skin darker because he did get sunlight, because if you just take PABA
Oh, yeah,
by
yeah, no.
if you just take
No,
it by itself, you're
right.
not going to turn dark.
No, I hope everybody understood
I
that.
wanted to
You're
point
taking
that
it
out
and
too.
going out there because it is a natural sunblock.
Yeah,
Why would you take it internally as a sunblock if you're not out in the sun?
Yeah.
Okay? Well, I tell you what, I want to get through this thing and hold your questions till the end. Make notes, please, all right? Thank you.
Yes, sir.
She only gave me 45 minutes. Man, I'll be here all day.
Okay, okay.
I mean, I love to talk to you, but she said 45 minutes. All right, and we're going to eat lunch, too. You guys want lunch,
Oh,
don't you?
okay, okay.
All right. Space Age in Medicine, in quotes. Professor Mester of Budapest University has made many experiments with animals and human cells to be able to explain the use of the function of light on the cell. Monochromatic light influences the DNA to use the lipoprotein, which is oil-based protein, lipo, in the area. So the cell has better function so as to produce collagen, which is the form of protein that holds the skin together. If you don't have collagen, you get wrinkles and everything. Elastin, that's another one. Makes the skin elastic. According to Dr. Messer's experiments, it was monochromatic light and not the coherence of the light. So in other words, instead of using laser, you could use the LEDs. Therefore, in later days, when companies started to manufacture LEDs, experiments showed that this monochromatic light, although non-coherent, which means that the light waves are not in step with each other, somewhat out of phase, has the same biological function on the cells. And as German said, 80% is efficient. That's pretty high, guys, 8%. Light attracts light. A study conducted at the phototherapy clinic of Schmal Geriatric Medical Center from October 1989 to March 1990, where researchers wanted to find out the effects of low-powered light therapy on the pain and disability in elderly patients with degenerative osteoarthritis in the knee. Their findings were published in the January issue of American Geriatric Society. And by the way, if you ever read any of this, see that you can go to the health Prior House Science Library at OSU and find these articles. I have many times when I used to do a lot of research go up there, and I can bring out articles on cures for cancer, natural cures for cancer, and I'll show the librarians it's right in these journals, right in their own library. And they're saying, hey, the doctors aren't doing it, how come they're not doing it? I says, they don't want to do it. There's too much money being made on drugs. You know, not the money, but the love of money is the root of all evil. But, okay, get back to, hold your questions to the end, folks. I know you got probably, they concluded the light therapy is effective in relieving pain and disability and degenerative osteoarthritis of the knee. A synopsis of the therapeutic effects of monochromatic single wavelength red light. And by the way, my photon torches use 660 nanometers. This was just made available in the 3-watt LED, which 660 nanometers is more compatible and more resonant with the human body, the human tissue. And it also works on horses, because I have, like I said, I have a farrier down in Texas who shoes horses, and he just loves it. He's seen some really miraculous things he's been selling for me. Now business has gotten a lot better. But let's see. In Europe during the 1960s, it was discovered that certain monochromatic single wavelength light beams had an excellent therapeutic effect on afflicted cell tissue. This occurs through a process called photostimulation. Various single wavelengths in the red and infrared color spectrum, 630 to 950 nanometers, and that's the measurement of the light wave. If you get that, nanometers is like a millionth of a meter, I believe it is.
Yeah.
Have been used extensively because they fall within the cellular range of biological tissue. However, the most widely used is a 660 nanometer red wavelength, and for years I was using a 627 nanometer because the more powerful LEDs weren't available in 660 yet. The lasers were, but not the LEDs. But just recently I was able. So anybody that bought which Diane did, bought one, I can either retrograde it with the 660 nanometer LED or just trade it in for this here, because this actually has a focus too. You can focus it down to a small spot like reflect points, acupuncture points, trigger points, or you can light paint an area, pulling this the lens allows it to, you know, like for a knee or whatever. I will tell you about that too. Okay, depending upon whether the light beam is continuous or pulsed, turned on or off very rapidly, and this one in particular has an 8.5 cycles per second, which on horses he found that the 8.5 cycles per second worked better for pain on the horses. Okay, generally solid beam lights will work for acute pain, but the pulsing works for chronic. In other words, it's been around a long time.
It also works for wrinkles too.
Yes, it does.
It does, the red light.
Okay, depending on whether the light beam is continued to pulse, turned on or very off, the single wavelength light photostimulates the affected cell tissue differently. Continuous light sedates the tissue, resulting in relief of pain, relaxation of tense muscles, and reduced swelling. In fact, if you have muscle spasms in your calf, you just light paint the area with this, and it'll stop those spasms within a minute or two. This is accomplished by an increase in cellular blood flow, which causes a warm feeling deep within the tissue, and by actual physical tissue relaxation. Pulse light stimulates the DNA within the afflicted cell, causing the cell to produce an increased quantity of protein and calcium, which we know calcium is the main mineral for the body, which results in accelerated healing of the tissue from 3 to 5 times faster than normal. And that's conservative. It can be up to 10 times. To reach the problem areas, the light beam can either be applied directly to the skin, like on the acupuncture points I was talking about, or light paint in the area, or reflex or the trigger points. And it penetrates about 1 inch into the soft tissue. I should change that. This was old information when I wrote this article. I'd copied somebody else's information. It's about a ½ inch actually. Lasers will go to about 1 inch, but not the LED. But that's good enough, okay? And for deeper penetration, the body can be applied to the acupuncture points. Like I said, behind that acupuncture point, this particular one, and all the rest of them on the body, it's like a fiber optic cable behind it, so that the light waves travel down, the photons travel down through that. So it can go, work on another part of the body if it's applied at one point. Okay. The light also acts as an extremely effective acupuncture point stimulator device, therefore using a combination of both direct application of acupuncture, acupressure point techniques, any problem. And by the way, this is the book to get. This is good for a lay person. This was put out by chiropractor J.B. Cerny. I'm sorry, he's not a chiropractor, he was a podiatrist and some other degrees here, but I really like this because
Can you read it, please? I mean, the title of it?
Acupuncture without needles. This is so good. I mean, he is a sketch artist too. Not only is he a doctor, he sketches out the areas and how to work. It's really great for a layperson because you get these acupuncture manuals. You better study acupuncture before you get, because you're not going to be able to understand. You're not going to be able to see it as well. This I highly recommend. Just starting out. You can use a finger. You can use an ice cube. You can use the light. You can use laser beam. You can use electrical stimulation. Whatever.
How does his last name, how's it spelled?
I'm sorry, J.B. is Victor, C-E-R-N-E-Y. This is available through Amazon.com. Either, I think it's still in print, either new or used. But even if it's not new, you can buy used copies. People have them and they're in different conditions. This was reprinted in '78. I don't think the guy's even around anymore, but I really like this so well. So it's just, and it gets into common problems that people have, not just something as obscure. I've seen some of this stuff that just, it's an obscure problem, but whatever. Okay, there are only two available methods of producing this desired monochromatic single wavelength light beam without introducing other light waves or impurities. The first is with a laser, like I explained, which has coherent light waves and step, and the other is with the light emitting diode, or LED as they call them. And most of you people see LEDs on your electronic equipment, and they're indicator lights, but they're very low powered. They're not going to work very well for pain, swelling, inflammation, like this would. The choice of material used in construction of both devices will determine the specific wavelength that is produced. Both devices produce a monochromatic single wavelength, but the laser produces coherent, in phase, like I said, while LEDs provide non-coherent, out of phase. This type of laser uses very low power compared to the normal high lasers that they use in surgery. Of course, they use it on eyes. You see these, the eye doctors, they run the infomercials on TV all the time. These are referred to as soft, cold, or weak lasers. And they produce only enough light power to stimulate damaged cell tissue. Soft lasers have been well researched and used all over for the past 30 plus years. It was particularly over in Germany and in Asia before it came here. And they were first using it on horses when it came here, and athletes. But now it's widespread. So there are available in many clinics, hospitals, doctors' offices around the world. The most extensively published uses have been for relief of pain, accelerated healing of wounds, treatment of skin conditions, wrinkle remover, and acupuncture point stimulation. Soft lasers are not readily available for home use. They are expensive and are approved for use only by licensed physicians, health practitioners, and clinical technicians. They can be harmful, and if overused, they come in contact with the eye. In other words, you can still, even though they're low powered and they say they won't, you could, if you hold them long enough and point in the eye like a kid would be looking at it, curious, you can burn the retina out. I don't sell them. I used to make laser. Take a hollow tube from a flashlight, medical flashlight, and put the laser